So some of you have sent a query about the Buerger disease or Buerger disease, Buerger disease. I prefer the term calling it Thromboangiitis Obliterans, TAO. Now, to understand this disease, I think you first need to focus on the term, the name itself, which is TAO, Thromboangiitis Obliterans. Angiitis means, angia means blood vessel. Angiitis means it's a inflammation of the blood vessel. It's a vasculitis, and this vasculitis is forming a thrombus. That's why the name is thromboangiitis. As a result of the thrombus formation in the lumen of the blood vessel lumen is getting obliterated. That's why the name is Thromboangiitis Obliterans. So Buerger disease is also called TAO. The scientific name is TAO, Thromboangiitis Obliterans. So this is a form of vasculitis where the action is basically not so in the blood vessel wall, because vasculitis typically means inflammation of the blood vessel wall, but the more action is happening in the lumen. There's a lumen, there is a thrombus formation, there is a thrombus microabscess with neutrophils. So there's basically a thrombus, progressive large enlarged thrombus formation is occurring, a clot formation is occurring inside the blood vessel wall, and that is occluding the blood vessel wall. Now, as this disorder typically affects the arteries and the veins of the distal extremities, the peripheral portion of your extremities. So that's why, what will be the outcome? As those blood vessels are cut off, the blood vessels which are supplying to your distal part of your body, like radial artery, ulnar artery. So obviously those part of the body which is supplied by those part of the body, that is the distal part of the body, you'd be feeling the pain of ischemia, because those areas not getting adequately supplied anymore. So there will be ischemia, there will be gangrenous necrosis, there could be auto amputation of those parts. Typically they have Raynaud phenomena also. Why they have Raynaud phenomena is simple to understand, because Raynaud phenomena need that these blood vessels in the distal extremities are already occluded, almost obliterated by this thrombus formation. Now if you expose them to a colder temperature, there will be vasoconstriction of this blood vessel. So even they would be further, lumen would be occluded, completely cutting off blood supply. So that's why Raynaud's phenomenon occur is this vasculitis. Another thing you have noted that this is a vasculitis which typically involves not only the arteries but also the veins. That's why superficial venous thrombophlebitis, that is the inflammation of the vein as a form of nodular area, that could also occur. So they involve not only artery, also vein, also the nerve. Why the nerve involvement occur? Well, obviously there is a thrombus formation is occurring. The thrombus could become a big, large, and that could compress the surrounding nerve structure. Compression, atrophy of those nerves can occur. Those nerves, basically those blood vessels which are supplying the nerve, they could also be occluded, causing ischemic injury to the nerve. So nerves involvement is also characteristic of this, and this is a form of vasculitis which typically presents with severe neuropathic pain, which is quite uniqueness also. Why this disorder occurs, nobody knows for 100%, but the idea is basically there are two hypotheses there, that when because you already know that this is a typical disorder which is common among heavy smokers, typically males between 20 to 45. Now it is also commonly described in the females, because females also the smoking is increasing and typically seen in certain geographic part of the world, like Israel, like Mediterranean region, like Eastern Europe, like India subcontinent, Japan, and all this part of the Middle East, all this part of the world where there is a increased incidence of the smoking is there, and certain part of genetic influence is also there, because certain HLS, HLA5, B9, these things are 54, these things are also been associated with that. So in a genetically predisposed individual, when you smoke, either that smoke cause some triggering reaction to the endothelial cell, kind of idiosyncratic toxicity they say, and endothelial cell now bind with the blood component to form a blood clot inside the lumen. And another hypothesis is there that these smoking causes some changes into your blood vessel wall. The blood vessel wall components, the collagen, other things changes. So immune system starts to think those modified blood vessel wall component as something foreign, and they react against them. These are two ideas why this thing occurs. The Thromboangiitis Obliterans occurs. And so you already know that typical patient would be a 20 to 45 male smoker, but in certain studies like in Japan, they have seen it's also seen beyond 50 also. So it's not strictly right now between 20 to 45. Another thing I think it's interesting about this disorder is their presentation. Presentation would be typically some kind of pain, claudication at the pain at the when there's activity, pain at rest could be there. There would be ischemia, digital ischemia, digits with finger, there would be ischemia. There could be gangrene, there could be necrosis. Sometimes there will be auto amputation of the fingers. These things could occur. Raynaud's phenomenon could occur, which as I mentioned. These are the typical presentation would be there. And I think you already know that simple tests like vascular flow test, Allen test would be positive typically. Angiobrachial index could be seen. So these are the things which you saw, but these things are not specific for this condition. So what you need to rule out that this is not atherosclerosis, because other than smoking, the other risk factors for atherosclerotic sclerosis should not be there. This is a non-atherosclerotic segmental occlusion of the blood vessel. This is the hallmark feature of the disease. So the cause should not be atherosclerosis, which is resulting in occlusion. This is a non-atherosclerotic cause, which is causing occlusion of the lumen of the blood vessel wall due to thrombus formation. And this thrombus formation is not occurring through the entire lumen of the blood vessel wall, it is occurring segmentally. Some areas are involved, some areas are spared, next area is involved, next area is spared. This is the feature. And on the biopsy, the characteristic feature is that internal elastic lamina is not involved by the Thromboangiitis Obliterans or the Buerger disease, they say. And don't confuse the Buerger disease, Buerger disease, with another similar sounding term named Buerger disease, which is Buerger disease. That is part of glomerular disorder, nephrology. Buerger disease, Buerger disease is the other name of IgA nephropathy, which usually presents with glomerulonephritis or isolated hematuria in a young male, typically young patients. So it's completely different. It's a glomerular disorder involving the kidney, renal disorders, and this is Buerger, which is the Thromboangiitis Obliterans or form of vasculitis. So this is a vasculitis. Basically, the uniqueness is that the action is happening within the lumen at the interface of endothelium and the lumen. The lumen is getting occluded by a thrombus formation. The lumen is getting obliterated by thrombus formation. That's why its name is Thromboangiitis Obliterans. And as a result, the corresponding area is not getting adequate blood supply. That's why the person is feeling pain and the other relevant problem, because those part of the body, they are not getting adequate blood supply, because those blood vessels supplying those areas, the distal part of the bodies, they get occluded by this thrombus formation. That's why the name is Thromboangiitis Obliterans. And as I mentioned, this is typically not occurring everybody. Certain HLA, genetically predisposition is required, smoking is required, and certain part of the geography is required. So nature, nurture, everything is basically taking a role. Genes are also playing a role in the involvement of the disease. And also the another part is that you need to rule out the differential diagnosis. There is no specific test for this disorder. So overall, the typical background, you need to rule out that there's a middle-aged, young to middle-aged male who's a heavy smoking history, who's presenting with this kind of feature. As I mentioned earlier, they are having this. Then you have to think about that, and you need to rule out the other diseases like other autoimmune disorders like SLE. Then you have to think about the APLA, or you have to rule out the obviously atherosclerosis. Atherosclerosis should not be always ruled out at this thing. And this is, as I mentioned altogether, that this is basically a disease, if you want to put in single sentence, Thromboangiitis Obliterans is a disease which is involving the medium to small size arteries and veins and also corresponding nerves, typically in the distal part of the extremities. And what they are causing in the blood vessel, acute and chronic inflammation, segmentally, resulting in thrombus formation. And thrombus is obliterating the blood vessel lumen, causing cutoff of the blood supply. That's why it is also known as Thromboangiitis Obliterans. I think this is a kind of brief summary I feel about the disease. I hope this helps. Thank you so much.